Let us bring our attention to this quite spectacular chart in which you see diastolic and systolic blood pressure. Now, the outcome here is obviously a comparison to a placebo, but the outcome here that we're paying attention to is a result of the consumption of 740 milligrams of pomegranate extract, which was standardized, no particular brand, but the composition was 36% punicolagens, which is an ellagitannin, and 1.3% ellagic acid. Some of the technical aspects. But look at this. Look how fast it began to work. And that is just 12 weeks of really doing nothing more than consuming 740 milligrams of this particular pomegranate extract. So without further ado, let's get right into the study, which really was designed to address inflammation. And also, too, before I drop off this chart, is they believe that this result was due to improved endothelial function, which resulted in the incredible blood pressure results with regard to the outcome of this particular study, which is as follows. Effects of pomegranate extract and inflammatory markers and cardiometabolic risk factors in adults aged 55 to 70 years of age, a randomized controlled parallel trial. A little bit of the backstory. Aging has been associated with increased inflammation, often referred to as inflammation, a chronic low-grade inflammatory state characterized by increased levels of pro-inflammatory markers such as interleukin-6, 1, C-reactive protein, and TNF or tumor necrosis factor. Inflammation is believed to play a role in the development of various comorbidities, including cardiovascular disease, diabetes, and neurodegenerative disorders. The pomegranate, a fruit representing a rich source of antioxidants such as ellagitannins, particularly punicolagen, which is unique to pomegranate. And that's kind of interesting because ellagitannins is fairly common, I should say, but the punicolagen pomegranate has been shown to exhibit one of the highest levels of antioxidants activity among polyphenol-rich foods. Now, a little bit of the methodology. As you can see there, the pomegranate extract, otherwise known as PE, 2 370 milligram capsules of pomegranate extract daily for 12 weeks. Again, the composition, 36% punicolagens and 1.3% ellagic acid. The results. The results of the trial align with a body of evidence that supports the beneficial effects of pomegranate extract on inflammatory markers. A meta-analysis of 16 randomized clinical, always important to have redundancy, clinical trials include 572 individuals reported a significant decrease in interleukin-6 levels. Yet it was limited by different dosages and formulations. Everyone did their own study, or juice or extract, as well as trial design and population health state. Still quite fascinating. As we proceed forward, the blood pressure lowering effects of pomegranate have been widely documented in our previous short-term studies. Quoting, "We observed significant reductions in blood pressure among healthy individuals. Additionally, a recent meta-analysis of 22 randomized controlled trials found that pomegranate was associated with significant reductions in both systolic and diastolic blood pressure, with greater reduction in those that have higher systolic blood pressure at baseline. An outcome that is consistent with, quoting, our findings. The significant decrease in systolic blood pressure after 12 weeks of pomegranate extract supplementation, again, look about 5 points or so, may have important clinical relevance as it's reported that the 5-point reduction in systolic blood pressure can reduce the risk of major cardiovascular disease by 10%. And this is really doing nothing more than consuming 740 milligrams of pomegranate extract over a 12-week period of time. This finding may have significant implications for clinical practice as it may help to support hypertension prevention in older adults. Again, the blood pressure lowering effect they postulate is possibly due to the ellagitannins, especially punicolagen, in regard to endothelial improvements. And to proceed to our conclusion. You know what's interesting too? Nowhere out here do we mention urolithin A, which is also a very positive aspect of pomegranate. To proceed, the trial demonstrates that pomegranate extract may be beneficial in reducing inflammatory markers and blood pressure among older adults, where these factors are often elevated. the consumption of pomegranate extract may offer a valuable non-pharmacological strategy to promote healthy aging. However, confirmation, obviously, redundancy is important, and a larger long-term trials with more diverse population is needed. Future research should additionally investigate its practical application in clinical settings while assessing its long-term benefits. Again, I want to bring up real fast that one chart that we started with in the beginning in regard to blood pressure. Again, correlation potentially with allogitannins and reference to inflammaging. And so this pomegranate extract, with its unique punicolagen content, may have a real promising future in helping offset such elements as inflammation, as well as helping better endothelial function. Again, gratitude to the researcher, incredible research. I am humble you watch, and look forward to see what you and I both discover next week. All right, catch you all next time. See you then. Bye.